Welcome back to Midday. We have Manshadi joining us from Manshadi Pharmacy and talking about a very common, is what you were saying, a very common condition called edema, which is, I guess, the medical term for swelling, right, Misa?
Exactly. It's a medical term for swelling. Yeah. When the fluid builds up between tissues and gets trapped there, we get edema or swelling.
Okay, so this is quite common. Maybe we can just put the first slide up here to give people an idea of the signs of edema and what to look for.
Yeah, these are some, they stretch or shiny skin. Sometimes we see the legs or arms are swelled up. Sometimes abdominal, and sometimes skin is a dimple. That what it means when you press it, stays
as a dimple?
Yeah, for a few seconds.
Okay.
Yeah.
What would be the causes of edema, Misa? What would what do people, should they
Exactly. This is a mild causes, when people are sitting or standing.
Is
or
this
walking.
Sitting, standing, walking too long?
Correct.
Okay.
Too long. For some people, even short time.
Right.
It really depends on the health of individuals. Eating salty food, premenstrual signs and symptoms, and pregnancy. These are some of the signs of mild edemas.
Okay.
These are some of the most common severe cases of edema: injury, medication, congestive heart failure, kidney disease, liver disease, weakness or damaged veins, and a problem with the lymphatic system, which controls the fluid between the tissues, and removes it.
How would you treat something like this? Or I guess maybe first of all, what can be some of the, you said those are the severe and the mild causes, but I know that medications was one of the first things on the severe causes, and that is something that can actually be quite serious. Edema
has to be looked at carefully and by healthcare professionals. If I see a swelling of the legs, I send patients to the doctors immediately. Sometimes there can be medical emergency, such as DVT, deep vein thrombosis, which one of the legs swells up and there's a pain in the calf, and when you touch it, it's kind of warm, and that's, kind of serious condition, and individuals should go to the emergency immediately. So edema, if you're not expecting it, has to be looked at it very carefully. If someone has shortness of breath or, for example, pain in the chest, these are some of the signs that needs to be looked at. It might be pulmonary edema and congestive heart failure and so forth. So it's a serious condition, but we do have some treatments.
Can this affect anyone of any age, Misa?
Absolutely. It really depends sometimes with the health of the individual, but I have seen some athletes, they have varicose veins, even though in a very good physical condition, but you do see the swelling of their calf muscles.
You wouldn't think it would an athlete that would happen, but I guess it can. We have the treatments, a list of treatments here. Maybe we can put those up.
So sometimes exercises and moving around will help for some individuals. Diuretic medication, they are milder diuretics for mild edema, and stronger diuretics for more severe edemas. We have also stocking. I don't know if we can show it or not.
But Misa brought a few stockings here, so we can have a look at those.
Yeah, so these are, for example, this is a prescription which we sell in our pharmacy. It's between 20 to 30 millimeter of mercury, and this is for decreasing the edema, and these are the over-the-counter one, which is between usually 8 to 20 millimeter of mercury, and these are can be purchased at our pharmacies, and different pharmacies, they do sell it. So we're going to go back to the treatment. And there are some natural medicines such as red wine leaf extracts for certain swelling does work, rising up legs, and sometimes people have to do surgeries of the veins and lymphatic system.
Interesting.
Yes.
All right. Well, thank you so much, Misa.
Thank you.
Good to know about edema and, of course, how serious it can be. So make sure you're paying attention and contact your health professional if you need to. Misa, his information is on the screen there, manshadipharmacy.com. I know you're a busy guy, Misa, opening up that next location. So we thank you so much for joining us today. We're back in a couple of minutes with Linda Coles from Sahali Liquor Store. Stay with us.